Good afternoon. My name is Shay, and I'll be your conference operator today. At this time, I would like to welcome everyone to the Getting Started Fundamentals of Building a CHW State Network. At this time, all lines have been placed on mute to prevent any background noise. If you should need assistance during the call, please press star, then 0, and an operator will come back online to assist you. Thank you. Ms. Julie Avertine, you may begin your conference.
Hello, everybody. Welcome. Thank you so much for joining us today. I just want to get you acquainted with some of the technology that we're going to be working with today. If you want to direct your eyes to the center of the screen, that is where the slides will be, and all of the questions that we're asking the panelists will be there. And if you have any questions for the panelists, we do have some Q&A sections reserved for you to ask your questions. Please direct your eyes to our chat. It's on the left-hand side, right under the participant list. My text is in pink, and that has our dial-in information, and you can type right into that chat and ask any questions, and they will either be answered on the call today, or if we run out of time, they'll be answered afterwards and emailed out. Thank you so much, and now I'm going to turn it over to Sergio.
Hi, good afternoon, everyone. Thank you for joining us for the second webinar in this series here that we've been planning. For those of you who joined us last month, you might remember that that first session was focused around sharing learnings and best practices in the organizing of state networks, and that was moderated by Lisa Renee Holderby-Fox, for those of you who joined. The larger context of this webinar series is really strengthening state networks and building capacity, and the name of this particular webinar, of course, is a consideration of the early days in some examples of organizing efforts. Primarily to look at the fundamentals of building a CHW network, as you see in the title. The organizers of this webinar are Gail, myself, and Carl, which is also listed there, and we receive extensive support from Sanofi, and Anita is with me here. We're sharing the space. She'll speak in a moment. I just want to take a moment to describe to you that we are going to be following a panel format, and we have an esteemed group of panelists whom I will introduce to you in a hot second. We have 3 regions represented here. One of them is a more contemporary and newly emerging network, while 2 of them are actually, and a third has a very long and rich history of organizing. I'll get to those panelists in a hot second. The format for the webinar will be that we will ask 4 questions, and each question will be responded to by all of the panelists. And then after all of the panelists respond to each individual question, we have a short amount of time set aside to address your questions as they come in. We realize, of course, that we will not be able to address all questions, but we do promise to follow up with you on all the questions that that Julie receives in the chat box. I hope that's clear. So please let me introduce to you Anita, who is sitting here with me from Sanofi, to explain a little bit about why Sanofi is involved.
Hi, everybody. Thanks for joining us again. If you're new this month, we're thrilled to have you. And if we had you before, thank you for coming back. That means that it was effective and productive use of your time. So we're thrilled to have you. I just wanted to share a little bit about who Sanofi is. We are a global healthcare leader focused on patient needs. We are involved with research, development, manufacturing, and marketing of therapeutic solutions. And you can see listed on the screen, we have 7 growth platforms: diabetes, vaccines, innovative drugs, rare diseases, consumer healthcare, animal health, and emerging markets. And Sanofi is a global company, as I mentioned. It's a name that is not a household name in the U.S., but many of the products I'm sure you would be familiar with. If you want to move to the next slide, Julie, that would be great. So you might wonder, why would a company such as Sanofi be engaged in working to advance this workforce? And really, it's that the work of the community health workers, we respect all that you've accomplished historically and the direction that this workforce is moving to really change the needle in terms of health in this nation. And when we look at our mission, we see how well aligned the work that the community health worker does with our mission. So you can see here there's 3 bullets: preventing disease and supporting patients. Well, that's really what you do through your work. You support patients to improve health holistically. Improving access to health care, we realize that the CHW can link the right patient with the right intervention at the right time, and the traditional role of the community health worker does look at the whole patient and engages them with the community with appropriate interventions. So that's something that improving access to health care ties in very well with our mission. And then exploring boundaries of medical innovation, we believe by supporting the growth of your network and the CHW workforce for prevention, and we look at new care models that are emerging with community health workers as central roles in those new care models. So the work of community health worker really addresses 3 of Sanofi's mission statements. If you want to go to the next slide, Julie. So I just want to give you an update on where we've been. We really appreciate the international our company as an international organization, as I mentioned earlier, really appreciates and values the work that you do. And we would like to advocate for the advancement of the workforce and the profession by providing support and resources. And that's why we've worked with Sergio and Gail and Carl to bring this to you with the esteemed panelists who you'll hear from later. We're interested in developing solutions which could really leverage the high-quality work of the community health worker to improve health care in the areas of prevention, intervention, and community impact. In November of last year, we convened an advisory board, and we learned so much and got a much better understanding of the impact that the community health worker role can have in disease prevention. And we are interested in helping pave the way for the development of a CHW national organization. And that was one of the big things that a big learning that came out of the advisory board, that there is really a need for this CHW national organization. So to the extent that we can, we'd like to help catalyze that activity. And we are, just a few other things, we're helping sponsor the Unity Conference. We're working with the National Health Plan to look at the role of community health workers in adherence, to build value to multiple stakeholders. And we've also compiled an electronic portfolio with all the evidence that you've provided through the years, supporting the strength and impact that you can have on CHW interventions by the work that you do. So I just wanted to share that with you, and then thank you for joining us today, and thank the panelists and especially the leaders, Sergio, Gail, and Carl, for helping us lead and come to this point. Thank you. And I just for a minute wanted to introduce Sergio. Many of you know Sergio. In the community health worker space, he's really an icon. He is currently the executive director of the CHW network of the New York State. He is a former chair of the APHA section and has wonderful models that he's put together in terms of core competencies and training curricula, and really is a force at the CHW APHA section. So, Sergio, I want to introduce you and turn it over to you. Thank you.
Thank you, Anita. That was very kind. So let me just tell you really quickly here, the goal of this webinar series, the larger webinar series, is really to help people develop and organize and strengthen whatever already exists on a state, local, maybe regional level in order to advance the CHW workforce. The reason that we've embraced that goal and the larger purpose of all of this is really towards developing a national organization of community for our profession, for the community health worker profession. And we hope to do that through creating a platform of support and education where we can all share our experiences with each other, so that maybe some of the older and longer existing networks can share with the newly emerging and fledgling organizations. We fully realize that in order to become a national movement or a national organization, we need to develop CHW leadership at a more local level. And so that's the reason why this goal and this particular purpose blend so well. Julie, may I have the next slide, please? So, this is our esteemed panel of experts here, and I would like to introduce them to you. Many of you know all of these folks for many years their many years of contribution to the community health worker field. On the extreme left there, we have Maria Lemus, who is the founding executive director of Visión y Compromiso, the Promotoras and Community Health Worker Network. The Visión y Compromiso provides leadership development, capacity building, and supports advocacy efforts for promotoras and community health workers. Maria has extensive management experience in health systems at the state and county level, and as a community consultant, Maria has provided organizational and administrative assistance to small and medium-sized nonprofits. Maria has also worked to improve local school systems by participating in school PTAs, site council, and education reform. Maria continues towards a dignified and healthy life for Latinos and considers it an honor to work with promotoras and community health workers towards that end. I will say that I've known Maria Lemus for many years, and this is a very modest introduction. Maria has done much more than what is stated here. Visión y Compromiso, a 501c3 organization, is committed to creating and sustaining a statewide, consumer-driven approach to promoting the health of Latinas, Latinos, by supporting and integrating the work of promotoras and community health workers. Visión y Compromiso hacia una vida digna y sana, working towards a dignified and healthy life, a Spanish-speaking community-based self-governing organization that serves as a model for self-determination, family inclusion, and participation in all aspects of community life. I've never quite heard social justice stated so succinctly. From Connecticut, from the great state of Connecticut, we are blessed with the presence of Jacqueline Ortiz Miller, another dear friend. Jacqueline Ortiz Miller is a community health worker and community health worker consultant at the Center for Community Research at Connecticut Children's Medical Center in Hartford, Connecticut. She works on an obesity prevention program called Steps to Growing Up Healthy, and Newman's Own with Dr. Michelle Cloutier, the director of the Asthma Center at CCMC, and the creator of Steps to Growing Up Healthy. Growing Up Healthy is an evidence-based program that prevents obesity in young children. She is currently completing her degree in Human Services at Springfield College in the class of 2015. Jacqueline is a current member at large of the Connecticut Community Health Worker Association. She is a member of the American Public Health Association's Community Health Worker section, and in November of 2014 was named chair of the Nominations Committee. She is also a member of the Multicultural Health Network. She is a current fellow of the Connecticut Health Foundation class of 2015, and she is also a fellow with the advisory committee of the Community Health Worker Common Core C3 project. This is a national study led by Dr. Lee Rosenthal and Carl Rush that is looking at the scope of practice and roles and skills for the CHW workforce. As part of this project, she also co-chairs a CHW advisory committee made up of CHWs from across various states. Jacqueline is a member of the New England Coalition of Community Health Workers. She has been a community health worker for 5 years. She is very passionate about her community, its challenges, and she strives towards bridging the gap to health within her community as a public health worker. With respect to her workforce, she advocates to bring awareness of the value and integrity of the CHW workforce. Jacqueline enjoys her work and is guided by a quote from Pablo Picasso that says, "The meaning of life is to find your gift, and the purpose of it is to give it away." Representing the great state of Michigan, we have a posse. We have Katie Mitchell, who serves as the project director for the Michigan Community Health Worker Alliance. She has worked with MICHWA since its inception in August of 2011, supporting the partnership by engaging CHWs and their stakeholders statewide. Her primary research and professional interests include CHWs, health equity, and socially just design and delivery of healthcare and human services. In addition to work with MICHWA, Ms. Mitchell serves on the American Public Health Association's Community Health Worker Section Council as the annual meeting program planner and teaches healthcare policy to graduate-level social work students. Katie holds a Master of Social Work degree from the University of Michigan. Joining Katie, we have Celeste Sanchez-Lloyd. Celeste Sanchez-Lloyd has a Bachelor of Science and a Master of Arts. She has spent the last 12 years working primarily with the Hispanic community in underserved situations in Indiana, Virginia, and Michigan. Her community health education interests include prevention of health disparities within the Hispanic community, inclusion and diversity, and equal education opportunities for children in underserved communities. Her past consisted of working as a community health worker for 8 years, both volunteer and paid, 4 years as a community health educator, primarily for CHWs, and recently program manager for a federal Healthy Start program on decreasing health disparities and fetal infant mortality among African American and Latino families. Her goal is that through various formats of involvement and drive, we will continue to tackle all areas of health for underserved communities. Celeste currently also sits on Michigan Community Health Worker Alliance Steering Committee, Active Communications Chair, and Educator for CHW certification per MICHWA. And lastly, my friend Marta Lugo Rodriguez. Marta Lugo Rodriguez is a community-based doula from the Health Connect One pilot from Chicago, Illinois. She supports and educates pregnant moms in the Southwest Detroit area at Community Health and Social Services Center, also known as CHAZ Center. Marta says she is proud to say that she's been a community health worker for more than 15 years. It has been a great and beautiful journey, she claims. The best part is being able to help, engage, and support our clients and make the difference in their life. She is also a co-leader of the Michigan Community Health Worker Network and a steering committee member of the Michigan Community Health Worker Alliance since its beginning. So please help me welcome our esteemed panel. Julie, may I have the next? So if we could go right to the first question. If we can ask you panelists to think back to your early years, Gail likes to say when we were 3 or when we were 5, from your experiences after gathering initially as a small group with common organizing interests, what made you decide to continue your efforts and continue to organize around building your state networks? That is, what was your group's original purpose or your original goal? And if I could ask the group from Michigan to address this question first, please.
This is Katie Mitchell from Michigan. Thank you to all who are attending today. Celeste and Marta and I are going to rotate off, so I'm going to take question 1, and you'll hear from all 3 of us throughout the afternoon. In terms of our efforts for building our state network, we have really stuck to our original purpose from the beginning. MICHWA was formed out of a very much felt need that CHWs were not being sustained. Our original launch came because there were programs all across the state who kept bumping into each other in different capacities, figuring out that they all had the same issues with financing, with training, with supporting each other. CHWs would run into each other at different events and slowly start networking and sorting these different things out. And so we finally all came together in August of 2011 to really address the sustainability issue, and out of a stakeholder meeting, MICHWA was launched. We stuck to that purpose of really seeking after sustainability through our mission, which is to promote and sustain the integration of community health workers into Michigan's health and human service systems through coordinated changes in policy and workforce development. We chose to continue after that initial meeting and form MICHWA because we really wanted to make sure that the momentum wasn't lost. We had some great national speakers, both Gail Hirsch and Joan Cleary, who attended that first meeting and really impressed upon us the need to have a real trajectory, a real structure to support the workforce as a whole. There have been 2 previous efforts in the state of CHWs trying to organize and build capacity and strengthen each other and really do a lot of that networking work, and neither was able to sustain itself, both due to funding issues as well as just lack of time and ability to do all those different things all at once off the side of your desk. And so through that, we had a real felt need, a lot of collaboration, and we had a lot of systems that bought into that right away. From the CHW side of things, and Martha will talk about this later, but there was also very much a felt need to connect to each other, to help define what a community health worker really is, and really listen to what the CHWs were looking for across the state. And in slowly building those relationships, talking with CHWs, it was very, very clear that we needed to continue our efforts to move forward.
Thank you, Katie. Can I have the next slide? So, Maria, can we ask you to address the same question?
Good afternoon.
Hi.
We started in, the organization formally came together in 2000 when we received some seed money, a little bit of money, a couple of thousand actually, from a foundation to start bringing us together. But the work really started in 1997, 1998, when we started to get to know each other. And I consider that in 1998 we convened, I co-convened with another person, a HIV conference, Latino conference. And at that point, literally hundreds of promotores came, and we were kind of amazed that there were so many of us around. At that time I was working as a promotor, and we just started to wonder, well, what are you doing and what are we doing? And we started to share information. And then from that, it kept building, the momentum kept building. And in 2000, we said, well, why don't we just kind of put these linkages together and these groups together. There were 5 leaders who started, 5 promotor leaders. So we started with 5 regions in California. And we all had the same interest. Everyone that came to the meetings, everyone that came with the conviction to work towards what we're calling Así una vida digna y sana, was because of their commitment to community, their commitment to seeing more services in our community. And when we talk about digna y sana, it really was an important phrase for us at the community level, that they wanted to see, because jobs came into it, but that was not the reason why we formed this. We formed it really to provide services, to develop resources, to get to know systems, for us to understand each other, but especially those of us who are working in the same cities and the same areas. And that was really the momentum that kept us going, was providing, getting to know each other. And then it just grew. We started with 5 leaders. Now we're in 13 regions across California, some bigger, some smaller, some more active, some a little less active, but, thousands of promotores are engaged in this conversation. And really, the initial purpose was for us to provide leadership, to support leadership, trainings, and advocacy. And that still holds true 16 years later. And I think it is because the community is smart. The promotor community is really smart, and they know what they want, and they're not able to access the traditional venues for that. And so our organization is able to kind of bridge that for them and to provide them with the resources, the learning tools, as well as the political tools.
Thank you, Maria. Thank you. And so, Jacqueline, can we ask you to, Julie, can you advance the slide? And Jacqueline, can we ask you to address the same issue, in particular, your group's original purpose and goal?
Thank you, Sergio, and thank you, everyone, for this opportunity. So here in the state of Connecticut, we began our foundational work in 2012. What made us decide to continue our efforts in the state of Connecticut in terms of building our state network is that we wanted to advance the workforce through policy, education, research, and leadership, and this continues to be our mission. What we saw in our state was the need to identify CHWs and in our state and also their work. This, as many of you know, is a daunting task because CHWs have many job titles and some are volunteers. And what we found, quite frankly, was that there were many of us who were doing CHW work, but we didn't know that we were CHWs. Another challenge that we had in our state was that the CHW workforce is not recognized as a profession.
which did not allow for sustainable employment in our state, and many of our positions are still currently grant funded, and as you all know, with grant funded work, it's tied into a certain time frame, and once the grant is done, many CHWs find themselves unemployed. So that was another area that we wanted to address. So for us, we understood the need and the importance to educate, and educate first ourselves in terms of what was being done in other states surrounding our workforce, providing for network opportunities for us as CHWs to come together and talk about our challenges. And I can echo what Katie and Maria shared in terms of training. We saw that was a challenge. We wanted to identify the work that was being done in various communities in our state in an effort to share the value of our workforce and educate employers as to who we are, what we do, the return on investment, and the importance of recognizing us as a profession in an effort to seek sustainable employment. Thank you.
Thank you, Jacqueline. Well, that's quite an agenda you got there. So we have Gail Hirsch on the line. If Gail is monitoring incoming questions from participants. Gail, have you received anything that you want to extend?
Well, I do. I have a question that hasn't been typed in. Oh, there we go. There's a question from Letitia. So I'll just read it. It's a great panel. Community health worker is a sexy word, and everyone wants to identify as community health workers. With that said, how do you recruit community health workers? That can go to any panelist.
Katie, can I ask you to speak to that?
Sure. And Celeste and Martha, if you want to chime in, go on ahead. So one thing that we did right away as MISHWA is that we really wanted to make sure that we had some of our basics endorsed. So right away we went ahead and endorsed the APHA definition of a community health worker, and really tried to review what was out there in terms of job titles, what did CHWs do, what did that look like, and really make sure that our stakeholders as well as our community health workers were educated in terms of the kind of range that exists. Through that, our CHW network, which Martha co-leads, has been really instrumental in recruiting, and our communications group that Celeste co-leads has been instrumental in making sure that we've developed a lot of materials and a lot of outreach methods to let people know that they are CHWs, or to really find those CHWs who are in agencies or in areas that they don't know that they are one. We do occasionally encounter people who attempt to identify as a CHW, and at a function level they aren't. They're serving in another role, and we try really hard to do a lot of education to really showcase the functions and the roles and skills of a CHW in comparison to what they may be doing in their particular role.
Thank you, Katie. I would add, too, that a lot of the evidence is pointing towards a very concrete set of personal attributes that go into being a CHW that might help answer some of that question, Letitia, in that not just anybody can really be a CHW, but it really does require a specific set of personal attributes.
So
go ahead, Maria.
So we, in terms of recruitment, I just would like to break that into two sections. One is recruitment for promotores or community health workers for employment, and those usually have job requirements and very specific skills. And I think what Jacqueline just mentioned, kind of the definition of that, and what's the need of the agency, and then what are the requirements for individual and personal requirements for that person. But at the promotor community health worker level, at the promotor level, and the recruitment for that, in terms of a network to engage community in a network, we really speak to that community action and the willingness for somebody to engage as a volunteer first, and then as a staff. Our organization was founded not as because of the workforce needs, and it was founded because of social justice and community change. And I think the longevity of our network has been that premise. And now, as this person who typed it in, it's so true. Community health worker is a very sexy term, and much of the discussion, I think, is guided by employment. But really, the world of promotores is a huge world, and it's not specifically health directed. It is social determinants of health directed. It is our social ecological needs and approaches. And so to get beyond the recruitment, I think that for us, we really look at all those other places where promotores work and engage as the path towards employment if they choose to do that, or the path for development in the best way that they can perform their duties in their communities. I don't know if that confuses it, but recruitment for me is really, for us, is engaging as many community members in the work that they do and doing the best work that they can do as a community person or as if they want to go into workforce.
Yeah, thank you so much, Maria. We're going to move on to the next question, but I want to recognize Barb Hadley that you have asked a question about financing, and we will address that question. If we can come back to it today, we certainly will, but if not, we will address it after the webinar. Can we have the next slide, Julie? So I guess this next question, maybe we can ask you to respond to this first, Maria. If you could think back to the order in which things developed for you, what were your priorities in planning and building your state network? One of the reasons that we wanted this particular diversity of panelists is that you clearly come from a community organizing, social justice reason and background for organizing. And so I wonder if I can ask you to think back to the early days again and describe some of the specific steps that you took to develop your network.
Well, first of all, when we started, we were, and still are, primarily volunteer-driven. It originated with volunteers, and the majority of our network are volunteers. There are 2 paid staff that run the network, but besides that, the region and those who plan and organize the events and our conference of over 1,000 promotores, and all those are volunteers. And I think what holds true today that was important then is that this is their organization, promotores generally, and they come to the organization seeing a place where the voice is heard there, and it's follow through. So they develop work plans, they establish priorities, they set the projectors for each year, and it is their voices carried through in the way that they want to see it carried through. And I think that consistency and that holding true to the promotor voice is what has gotten us through very difficult times when, of course, as a volunteer you have no money. And now we're a very large organization, but it's still true that we run with volunteers. And I think that the credibility is important. The holding true to the voice is important, being a social justice organization, not going after the money, but really going after what's important in our communities and continuing to validate them. We say promotores are the most important people in this whole circle of care, and we validate that. We honor them, and we continue to salute them as being important and valued. And I think that brings us, what that does is that brings more people to the table. It brings more agencies to the table who want to support it. It brings more funders. It supports the work. But we do say one thing, and that it is not money-driven. Our work, for as large as we are, is not money-supported. We are here whether we have staff for it or not, and that's how it was for many years when we didn't have staff for it. And I think that's what built the credibility of this community organizing point of view that we have. And I think what we say also is that we do say that con dinero y sin dinero, and while it sounds a little trite, it is important because the social movement piece is going to continue after funding goes. And we have to build the core. We have to build the community first in order to move into other things. And we've been just successful with that. We have a huge commitment to that as staff, as promotores, and as leaders in our community.
Yes, thank you, Maria. Jacqueline, can I ask you to address the same question, please?
Sure. Thank you, Sergio. So for us in Connecticut, although we started our work in 2012, we're still fairly new and very green. Our staff is small, but I will echo what Maria says. Social determination is important. Everyone that is on our association and that leads our association are community health workers. Many of them started out as volunteers. Social justice is at the core of everything that we do. And we are a small group. We are trying very hard to focus. We're taking pieces of our mission, and the first piece is just education. And for us, what we did with the support of Southwest AHEC, just to talk a little bit about our foundational work, was that we helped develop 2 surveys that were sent out in 2012 and they were distributed to CHWs and employers just to better understand the characteristics of a CHW in Connecticut, as well as their roles and met and unmet training needs and employment status. And for employers, they were asked about funding mechanisms in place for CHWs that they employed, as well as attitudes about the use of a CHW. So in this survey, 43 CHWs completed the survey and 97 employers of CHWs responded to the survey. And had it not been for the collaborative effort of the CHWs and Southwestern AHEC, we would not have had this initial data that helped us to continue moving forward in terms of identifying the need to have training available and what the barriers and challenges were in various pockets of the community across the state. So that was really important to us as well. Thank you.
Thank you, Jacqueline. And Celeste, Katie, Marta, can I ask you to address this question also, please?
This is Katie. I'm going to start off and then turn it over to Celeste. In terms of order for priorities in planning and building work, we had a lot of things happen all at once, which helped drive a lot of our work forward. So on one hand, we had a lot of great momentum that built off of our founding meeting. So we had a lot of different subgroups that were immediately formed, and that was an integral part of our planning and our building. When we actually kind of stepped back and kind of looked at what had happened and where we wanted to go next, there were a couple of things really stood out as priorities. One of the main priorities was making sure that we did have staffing involved, and so I am the staff member for MISHWA, and making sure that we had kind of a point person over kind of all of the logistics initially, and then that we had point people over our different groups was essential to start off with, making sure we had working group leaders, that we had people who were willing to step up and volunteer and kind of own different areas. That was essential. We also set a huge priority of building our steering committee and really making sure that it reflects the diversity of the CHW workforce, as well as the CHW programs and employers and other stakeholders in the state. From there, we developed a mission, identified a governing structure, and then built goals and objectives for MISHWA as a whole, and then for each of our working groups that our steering committee approved as the working groups kind of went over their plans and then developed where they thought things were going. And from a steering committee level, that way all of the goals and objectives for each of the groups could be reviewed, identify areas for alignment, overlap, and really see what we were doing and how we were moving our mission forward. We also at that point identified guiding principles for our organization, the first of which is that CHWs are involved in leadership at all levels of MISHWA, which has been a cornerstone of our involvement. And we also identified that evaluation is key. And so evaluation is something that we do, as well as something that we really value to make sure that we're moving things forward. At this point, I will turn things over to Celeste, and she has a couple more things that she's going to add to that.
Thanks, Katie. This is Celeste. So just to kind of tag on to what Katie mentioned earlier, another component of driving the network was making sure that we were all on the same language. So you heard Katie state about the APHA definition. We wanted to make sure that we were connecting with our community health workers at every level, and we knew that there were CHWs out there that truly didn't have an identity or didn't know that they belonged to an identity because of the various names that circulate around for community health workers or promotoras. So that was really our focus, to make sure that we were advocating on behalf of community health workers, to know that although your name may be different, you're an active part of a community. We also needed to focus on where were CHWs actually located. As you know, Michigan is a big state, and although we have very centralized locations and also very urban locations, we wanted to make sure that we were capturing community health workers at every level. We made sure that our CHWs were active in one-on-one presentations. So we wanted to make sure that there was somebody at the leadership level and also who were at the ground level really pounding the pavement that could come and define what a CHW were for employers and stakeholders. And then definitely looking at how we could collaborate our voices and efforts through various communication networks, so Facebook, social media, bumper stickers, anything that was going to get our name and our face out there, we were really trying in all avenues.
Thank you, Celeste, and I apologize for mispronouncing your name. I will not do that again. Gail, did you want to chime in here?
Well, there are two questions that perhaps you can field, Sergio. I'll start with one from Rosalind now that I think is getting at the issue of what does your group do to make it possible for community health workers to actually participate in these activities? I think that may be the spirit of the question, because it says, what are some strategies that you have in place to encourage members to come out to meetings? And certainly I know in Massachusetts we found that sometimes community health workers aren't supported or allowed to come. I don't know if that was the intent of the question, but in general, how do you help community health workers to be able to come and to ensure that they come? That's question number one. So why don't we do one at a time, and then there's another one.
Okay, thank you, Gail. And yeah, that's a pretty universal challenge. Jacqueline, can I ask you to speak to that?
Sure. We in Connecticut have the same challenge as Massachusetts, where employers are not openly receptive to community health workers participating in trainings or meetings. So with our association, what we do, and I'm sure this is something that everyone on the panel can relate to, is we just have our meetings. Sometimes we have to have them on the weekends. Many times we have them at night after work, and we have dinner together. If we do it on the weekend, it's either a breakfast or a lunch. So we really try to just find a time when we can all come together, because we recognize the importance of having our regular monthly meetings. We also use technology. At times, if we can't make it, we will conference in together and still have our meetings. So you have to be creative in terms of trying to find a way to bring everyone together who doesn't have the access to do so. So that's one thing that I can say as far as our association does, is we really work around each other's schedule and support each other, because we're focused on our mission, which is advancing our workforce. Thank you.
Thank you, Jacqueline. I do see questions coming in, and again, we're going to try to address the second question that Gail is holding, but we will respond to these other questions offline. Gail, can I have that second question?
Sure. It was, this was from Letitia. Did any of the panelists have a challenge with engaging existing groups of community health workers when you tried to start your organization, pre-existing groups?
Nice question. Maria, can you speak to that?
Well, I'm going to follow the discussion that we just had about promotores and community health workers participating, because what has happened in the 16, 18 years that I've been involved is that there a hierarchy, an informal hierarchy has evolved. And so that hierarchy then says, I'm, for instance, a paid community health worker, or I'm a promotor in the community, or that, this distinction has arisen, and sometimes they don't want to participate in a grassroots level effort because there's a hierarchy that's evolved, or the employers don't want them to participate in these efforts because they don't know what the movement is. We call it the promotor movement, and they don't understand the benefits to their organization. So we spent a lot of time talking to agencies, and actually there are several coalitions across the state that we're supporting and have formed in support of the promotor movement, because we want to educate them about how they can, as we say, how they can best integrate promotores to be part of their organization. And I think much of it is centered around knowledge, not understanding the model, not understanding the work, and how it can best be integrated. But we find because of that, there's a lot of resistance. And sometimes it just takes one-on-one, which is really time-consuming. I mean, they have to go to these agencies and to speak to their EDs and to speak to their program managers, even the coordinators. Much of it is just lack of information and knowledge, and not understanding the benefit that engaging with the discussion that it would bring to the organization, as well as to the professional development of the current employees.
Thank you, Maria. That's a really, really, really penetrating and thoughtful response. Thank you. Okay, so can I move to the next slide, Julie? So for the third question, and maybe Jacqueline, I can ask you to respond to this first. But what resources did you find that you really needed to begin and to develop your organization? What original support systems or resources did you need to have in place at the beginning?
Well, I think for us, networking with other states was a valuable resource. Living in Connecticut, we're fortunate enough to sit between two states, New York and Massachusetts, who have made great strides in terms of the CHW workforce development, training, and their associations as well. So for us to establish a relationship with their associations, and as you know, Sergio, we've tapped into you for resources and information, and Gail as well, has been one resource that's been of importance value to us. There's also a New England CHW coalition that we're involved in, and they meet quarterly, and this allows us to learn from one another in terms of training or obstacles and barriers, and we have time to come together in those coalition calls and really support one another and brainstorm on ideas and learn about events that are happening across New England. In our state, the Connecticut Public Health Association has been a supporter from the onset in terms of developing our association. They've provided avenues to bring awareness to our workforce. They've also provided funding for some of our events, and we are currently in the process of coming under their umbrella as they support us in our 501c3 status. Another resource for us as well was the Connecticut Health Foundation. They supported our efforts by providing funding for research and consulting from experts such as Sergio Matos, who worked with us in developing our mission statement initially, and other foundational efforts that he helped us with in terms of providing us with policy information, developing marketing tools to help us spread the word on our association. And we were also able to have a consultant who was a former member of the legislature who worked on developing our white paper. So all this financial support has helped us to get to where we are today. Thank you.
Thank you, Jacqueline. Katie, Magda, Celeste, can I ask you to speak to that same question, please? What resources did you need in kind or otherwise at the very beginning?
Thanks. This is Katie. So a couple of different things real fast. So one of the things we needed was to spread the word. Just to reiterate what Jackie mentioned about networking, that was absolutely essential to continue building networks, reaching out to people, making sure that stakeholders of all kinds, CHWs and others, were aware that there were groups starting to get together to talk about community health worker sustainability, and we really wanted to make sure that everyone who was interested was welcome to join and participate. A couple other kind of concrete resources included conference lines. Those have been absolutely essential. Michigan is a fairly large geographic state. Many people forget about the fact that we have an upper peninsula. We're a mitten, and then there's a whole other part of the state above that. So we're fairly large and very geographically diverse. The majority of the state is rural, even though we have some fairly large urban hubs. And so making sure that we have conference calling capability to allow CHWs from all across the state to call in and participate has been really, really essential. We've also, again, to reiterate what Jackie was mentioning, have really valued working with APHA as well as connecting with national partners. It's been very essential to learn from other networks and to get their perspective on things. We've also, and I saw that this was already briefly mentioned in some of the questions, we were very fortunate when we started to have some fairly flexible funding that associated our launch. And so we did start off with a little bit of foundation money that helped propel our activities forward and provided to have staffing when we began. And that has really helped propel us forward in a way that is unique to some other efforts, but it's also really helped us to expand our reach, to travel across the state and to meet with people in person and to build those relationships, but has also allowed us to do things like employ some student workers to work on our evaluation, to create a lot of our materials, help drive some of our web and media items, and really support a lot of the ongoing work. I'm going to turn it over to Celeste now.
And just to add, we really focused on looking for key participants. And so when we say key participants, we were looking for employers that were really driven for sustainable employment for CHWs and that really had an interest or an investment in CHWs within their organizations. So they were looking for sustainable programs. They were conducting research on not just return of investment for community health workers, but really what was the benefit to the overall community. And so we really wanted those stakeholders to be at the table to kind of help to drive our conversation within other stakeholders that were probably either considering CHW roles or looking at long-term sustainability within their organizations for some of these programs that would be here today and unfortunately gone tomorrow because of lack of funding. Thank you.
Thank you, Celeste.
Can I just add to that a little bit? In the community organizing piece, and if I go back 16, 18 years, there was no support. And even today, there's minimal support for the community organizing piece of a network. And for those who want to engage in that, there may not be the funding, the structured funding that our the panelists have reflected, and it's a wonderful thing, but locally there may not be. And so I think that we have to rely on our innate skills, and that's how we learned it. When we started this, the people that I learned from were working in liberation theology, we're working with Paulo Freire, we're working with all these things, and we have to go back to thinking how is it that we can do things ourselves, look through our internal resources, and go back to potlucks, and go back to organizing in people's homes, and go back to all those things, which is actually how this network started. And I say that because there may be some groups out there who are listening to this who are thinking, well, I don't have the foundation support, I don't have the organizational support, I'm not there. But you can start that informal discussion. You can meet together over coffee. You can start the organizing piece. You can volunteer, your home for meetings. There's a lot of things that can happen until you get to the point that you can actually ask for funding to support the network piece of it. So I kind of want us to go back to that because I think there may be some who are not there, and I know that we are supporting some informal networks across the nation who are not there yet in helping them to get that structure so that they can be a little more viable.
Great point.
So we were just going to ask you to respond to that question, Maria. But I know that this is an issue which is very near and dear to your heart, and it's actually interesting. The richness of this panel and the diversity of perspectives is really exactly what we hoped for. So thank you for that response. Did you want to add anything? You have a minute or two.
I did want to say that there, because these other networks are kind of new, as old as we are, 18 years, 16 years old, there were still networks that were going on. There were trainings. You remember the group that was going on in Arizona for a very long time that had their annual convenings. There were groups meeting in Texas for a very long time. So there's a rich history of networks going on, that have been organized informally for a very long time, and that's who are our mentors as a network in California. That's who we look to, and I think that each state has community experts that I think would be really great to balance the work that's being done now as there's more structure to the network. We're also involved in advocacy. We have a policy director. I mean, we're involved in Sacramento and D.C. We're engaging with other states. We're building coalitions. So we're doing much of what's happening, but with other states. But the core of the work that we do still is at the community level. It still is with promotores. It still is engaging them in relating to each other, in learning the best tools, in being the best of whatever it is that they do. And I must say that the majority of our promotores in the network are not health related. We have to always remember that it is a big world, and we do respond to the larger community, and health is one piece of it. It can be a path if they want to go into that, because if you're working for Girl Scouts and you want to work one day for a clinic, that's a great path. But our world is huge, and as we start looking at policies and how they impact the larger promotor community, promoter/community health worker community, I think that's something that we keep in mind every day.
Yes, thank you so much, Maria. Gail?
So there's a question from Carol about how do you address the challenge of linguistic diversity in your organization? That is, what strategies, what resources, how do you deal with it, and whether or not it's a challenge, I guess.
I'd like to try to keep the focus on starting a network, and what were the early resources and that we had to attach or secure to do that. But if one of the panelists wants to respond to that question about linguistically diverse needs, I think that's a lot of people's reality. But if anybody wants to answer that specifically, I'll take your response.
Well, I'd like to to respond to that, because we're primarily a Spanish-speaking organization. Our media is all Spanish, our work is all Spanish, our conference, everything that we do. However, now we are being more inclusive in that other communities are coming to us. And so we've been training in Cambodian community and doing other things, because the core of our work really centers on what we call the espíritu de servicio, the heart, that it lays in everyone. And it's interesting that Carol asked that, because I said to her that we won't become multicultural until the community comes to us. Visión never imposes itself on any group or on any community. But now the community, those other communities, both African American, Asian Pacific Islander, and white communities are coming and asking, what is it that we do, and how is it that they can engage in that discussion? So I don't think it's a process where we force it upon others. I think that others have to realize that it is something that can be beneficial, and that we can share our knowledge with them. So I'm really happy that we're moving in that direction, and I think once the numbers grow, then the process and the procedures and the inclusion will grow. So I'm very hopeful for that expansion.
Yeah, thank you, Maria. Thank you for your perspective. I know this about you, but I'm glad that you verbalized that whole issue about not imposing on community, but having community come to you is a really critical social consciousness issue. So thank you again. I'm going to move on to the next question. Julie, may I have the next slide? And so I'm going to ask you to, maybe again for the last question, if I could ask you to look back again to the beginning, knowing what you know now, what were perhaps, if you can identify some of your fundamental learnings things that you would recommend to someone else who wants to start a new association. What are the take-home message, the big hit, the platinum hits from looking back? And Katie, Marta, and Celeste, can I ask you guys to take a shot at it first?
Okay, this is Marta. Basically, I want to say that the perspective of the MSHWA part, knowing your stakeholders is really important. Getting engaged in that is something that we really think is really important for us as for MSHWA in particular. Also taking, I want to say, don't take control in a lot of things of basically moving forward and knowing what to do next steps, engaging CHWs from the beginning and keeping them engaged. That's really something we all mentioned right now, that it's hard, but yet if it's possible and you believe in what you do, you can keep engaging. Especially me, who's part of a network lead, being a leader. It wasn't easy in the beginning, but telling you, once you see your group getting bigger and getting engaged with them, and how to do that is basically mostly doing events, doing things with them, honoring them, encouraging each other. That has been a really thing that for us. But also communicating with them, keep people in the loop and finding ways to track people. That we also mentioned that as well. You have to keep people engaged. As Michigan itself, being like Katie mentioned, it's big. We have different sections. We have to have our leaders keep in contact with each other to keep our other CHWs engaged in everything we do. Also, I want to mention dedicating having a good staff member, someone who's dedicated in what they're doing. Like I want to just honor this moment as well as Katie. Katie has been dedicated for us, and having that one particular person carrying each group, because there is not only a network group, we have 4 other groups, and having that one leader person helping us assist to make these things go forward. It's challenging for us CHWs who we work and also have to be a part of something important to us. We can't all the time be available, and at this point, Katie steps in and helps us in carrying these things. So these things are important for us, and not only for us, but for any network to go forward. You have to have a leader. You have to have the stakeholders. You have to have important organizations to be involved. And believe in what we believe in as well. So I believe that mostly that. I don't know if I answered the question well, but I think that's something really important for us as for Michigan, and as well as for the MSHWA standpoint. Katie, you want anything to add to that, or Celeste?
Yeah, this is Katie. I just reiterate what Martha kind of went over, is that we've had a lot of trial and error in terms of what works best with engaging our CHWs and our stakeholders, and it really varies. There are some seasons where we have CHWs who are able to be super, super involved, and their employers are on board with giving them leave time during the day, and others where we're doing, evening potlucks in person when we can, or we're doing, conference calls over lunch. It really has varied. At the same time, being flexible with how you engage those people. So we've done surveys, we've done contests. We have one right now to pick our CHW Appreciation Month theme, and people are engaging with that who will never call into a phone call, but they can engage by, submitting an idea electronically and participating that way. And so really, trial and error, understanding what works for the people who you are trying to reach, and really honoring and supporting the community that you are trying to support and organize.
Thank you, Katie.
This is Maria. I agree with what she said. I just want to, with what they just said, I just want to affirm that. I think it's really important to honor the community, honor the people, because we all come with different skills and abilities and talents and capabilities, and honor, the most humble to the most out there person. I think is really an important piece. And I just want to add to that also leadership. Leadership is really important. Somebody has to be a leader in this movement. Somebody has to be a leader in the network. And it could start with one or two people, but the leadership and that straight direction, always being constant, that constant person, the constant message, the affirmation of who they are and where they're going and how they're getting there. I think that's, for us, has been constantly 16, 17 years, and I think has borne us well. I mean, because they know they can depend on us. They, being the community of Brothers, know that Vision is there. We're there. We are them. We are fighting their battles. We are there supporting them. I think that's a really important piece for continuity and for consistency and for longevity.
Yes, thank you, Maria. Actually, we were going to ask you to comment next. So if you want to finish your thoughts, we have another 2 minutes or so.
Well, I just want to talk about then how the longevity piece and the continuity of the movement. Since we started with nothing for many years. We didn't even have money for travel. Didn't have anything. It was volunteer. I was volunteer. Everybody was volunteer. And the movement has grown because of the credibility of the individuals and the commitment that they have to making this happen. The popularity now, has moved us into a different arena where we now have the opportunity for work. But to always remember that we started the movement, and promotores are at their core, trabajadores comunitarios. We are in the community. We are those moms and dads. And I think to always remember that and always honor that as the premise of who we are, because when we go out, and I'm sure it happens for everyone, you go out, we meet very humble people who can be the leaders and are the leaders in a very discreet way. But then we go to a meeting and we're talking about, reimbursement and sustainability, and it has nothing to do with the mom and dad that we just talked to, who maybe have to go back to the field. So I think that we're caught in this great paradox, and what do we do as an organization, as a network? I think it is define your role and who you are and stay true to it in your community, and that would be the message I would end with.
And a wonderful message it is. Jacqueline, can we ask you to respond to this question of what thinking back to the very beginning, what were, if you could remember some of the important fundamental things that you learned, what would you share with someone?
What I would share, and Katie and her group and Maria have all addressed this question so eloquently and so well. I have to first say that the importance of the integrity of our workforce has to be at the forefront. We as community health workers, we know that we have this unique gift, which is developing trust in our community. And we need to extend that when we're looking at our workforce. As Maria said, many of our CHWs are volunteers or outreach workers. We're all at different levels in terms of the work that we do. Yes, health is in our name, but it is a small piece of what we do. So it's really important that we meet, just like we meet individuals in our work when we're doing outreach in the community where they are, that we meet each other where we are, and that we support one another and encourage one another, because to be quite frank, this is a daunting and can be a roller coaster of a ride in terms of emotions. I know for us in Connecticut, we still have a lot of work to do, and our number is so small, and sometimes when we have our meetings and we look at the bigger picture and the task that's ahead of us, there are times that, you want to quit, but you have to remember that you're not doing it for yourself, you're doing it for the workforce. So I think that's really important. And leadership is key. If you don't have the right leadership, it can make or break your association. So I think that's very important as well. And just always, again, having self-determination, I think, is important, and building that community capacity, that individual capacity and that community capacity, extending it into the network, doing the potlucks, meeting whenever you can, and just encouraging one another. If it's one thing that I think that is fundamental that we need to carry through that whole process, is always remembering who we are and that there is no I in team. It's always a we. So that's all I have to say. Thank you.
Thank you very much, Jacqueline. Gail, can I ask you to speak in here?
Sure. So this is a question that is one that seems to be recurring several times. So maybe people could speak to this, which is how to when some people don't identify as community health workers, how do you reach those people who don't identify as community health workers? Specific strategies for reaching those who don't identify as community health workers yet, I might add.
Right. Thank you. Yeah, that question has come up quite a bit here. Katie, Magda, Celeste, can I ask you to speak to that?
This is Celeste. I can start off, and then Katie and Martha want to jump in. One of the things that we've done on the west side of the state, for example, is been very strategic that when we provide education opportunities that are geared towards community health workers, meeting with managers and supervisors and leadership to explain the CHW role, and then also coming in to speak with the actual staff. And so not only does it give us an opportunity to define the community health worker role for individuals that may not have that title, but also walk them through what our organization as MISHWA stands for. And so we're able to bring up the APHA definition. We're able to have employees or staff tell us about their day-to-day, tell us about their work, tell us how they're involved in the community, and then take it from there and say, well, that's exactly what a community health worker is. No, you don't have to take a blood pressure, and no, you don't have to do biometric screenings in order to consider yourself a CHW or a promotora. But if you're somebody who is actively finding transportation for someone in your community to get to their appointments or translating documents that may be coming to their homes, that's what we define as a community health worker. What is the overall arch on how you're connecting your community to reduce health disparities or reduce some of those social determinants of health? So we've been very strategic on making sure that we go from leadership level down, because we really felt that if leadership doesn't understand the value of what a community health worker is, then it's very easy for our staff or for community health workers to get lost in that shuffle and say, well, do I really belong to this group or not? Also, you heard us mention the CHW 101 presentations, and we've taken those on the road throughout the state, just making sure that we're able to provide information, making sure that we're connecting with different conferences that are happening at the local level so that we can capture and kind of tie into, what do you define yourself as? And let's walk through that and see how that relates to the community health worker position. It hasn't been always easy, but we're slowly seeing that wave of individuals that are understanding it a little bit more and moving more to that title versus, patient advocate or community representative. So making sure that we're kind of falling under that umbrella.
Thank you very much.
Mm-hmm.
I can take one more short comment if you'd like. I don't know who that was. Was that Maria?
No, it wasn't me.
Okay. Yeah, I will share that, even though we've been around since 2001, we still get people come to the meetings today and say, gee, I didn't know I was a CHW till I got here. So I don't think this is going to be this identity issue is not one that's going to go away, but I appreciate you being very specific about the strategies that you've employed to reach out to people. Our network here in New York City is a lot like Maria's in that it's very grassrootsy kind of origins and spirit, and so we have a big practice of each one bring one, which helps expand so that once CHW comes to the meetings and finds a home, they can go back to their place of employment or their community setting and let that be known. So I want to mention that there are a couple of recurring questions that are emerging around credentialing and certification and invasion, for lack of a better word, from other practices, which sort of have to do with the CHW definition. And we're going to address those, but we're really trying to dedicate this webinar to the very early days for those networks that are new, fledgling, or just emerging. But those are wonderful, wonderful questions that we're getting coming in, and we'll publish answers to those as a leadership team with Gail, Carl, myself, and Anita, and the others, and we will get those out to you.
Future web.
And in my closing statements, we'll ask you to contribute to the topic of future webinars. But Shirley and Lydia, thank you for those questions. They're very important questions.
Sergio, I would like, if you're going to respond to some of those credentialing and certification, if we could contribute to some of that narrative. We are in a process that's slightly different. We're not looking at credentialing or certification as a state network. We're looking at core competencies and some of the work that's being built, with some of the work nationally. But it is a slightly different discussion, so I just would like to include it as part of the reference.
Yeah, that would be wonderful, Maria. Yes, I'll make sure that happens. And I will say to you that you are not alone in that camp. There are many people now who are backing off a little bit from the whole credentialing and certification question as perhaps being premature.
I think they need to know there are other options, and I think
right.
And also the scope of practice discussion that just happened. We're really talking. If we start using the language of scope of practice, that it's broad and start including. And I think what she described in her techniques to educate and inform community as well as providers and organizations is true. And I think we all have to do that. Otherwise, it goes amok.
Yes, thank you very much. I will make sure that you are engaged in the conversation. There are many. There's guild models. There's all kinds of ideas that we need to consider. Thank you for raising that. And so one final note of thanks to this esteemed panel. It was all that I could have possibly hoped for. We were really shooting for a very rich and diverse mix of both very experienced networks and newer or middle-aged networks. And so we think we really were able to pull that together. You guys were extraordinary in sharing your varied experiences and strategies and opportunities. I can't thank you enough. This is very rewarding for me personally, and we've actually gotten quite a number of comments saying how rewarding and refreshing this series is. I want to make a couple of closing comments. If you want to be added to this mailing list invitation, or you want anyone else added to it, please write to Anita O. Her email is Julie can post it on the webinar. I also want you to know that all of the webinar organizers and leaders here who are present and who have been creating this webinar series are all going to be at Unity. If you don't know about that, the Unity conference is going to be held July 12th through the 15th. And again, if you want more information on that, we can provide that for you. I also want you to know that at that Unity conference, which is really a premier national conference for and by and with community health workers, we will have a session on building a national CHW organization. And so we invite all of you to participate in that, as that is a logical follow-up to the webinars that we've been having so far. And in light of the fact that Unity will be in July, we will plan to resume this webinar series in September, right smack in the middle of September, on September 16th. I also want to share with you that you will receive a link to a survey that we send to everyone who attends the webinar, seeking your input, feedback. Your feedback to us is very, very important as we seek to improve and move forward, but also looking for your opinions about topics for future webinars. And lastly, I want you to know that the Facebook page that we had promised you is going to launch really, really, really soon. So again, we want to thank you for all of your input on that. So once again, I want to thank all of the participants. I want to, from the bottom of my heart, thank this esteemed panel. And Gail, Carl, if you have any last words.
This is Gail. There were some really great questions, and I really hope we can capture them and get them moving forward. So I guess that's what I would say. I would really encourage everybody to be engaged with this process moving forward, and if you can, be at Unity. But please, be very forthcoming with your questions, because we're learning from all of this. And thank you.
This is Carl. I very briefly want to add my thanks. I've been furiously taking notes here, but the theme of self-determination has come up a couple of times and towards the end of the session in particular, and I think we all recognize that this effort in strengthening the state networks is vitally important in really pressing that notion of self-determination as decisions are made about community health workers, that the networks be driving the process. So thanks, everybody, again.
Thank you, Carl. And Julie has advised me that Anita O's email is at the bottom of that last slide here. That is the thank you slide. So for those of you who want any further information, if you want people added to the invitation list, if you want some, that will all come from Anita Nebnoma. Thank you all, and have a good day.
Thank you. Bye-bye.
Bye-bye.
This does conclude today's conference call. You may now disconnect. Presenters, hold the line.